Hi viewers, this is Dr. Muhammad Iftikhar Aslam from Pakistan. Today I'm going to present my lecture on West Nile fever that causes the diseases like West Nile disease or West Nile neuroinvasive disease. In today's lecture, we will cover the information regarding the organism that causes West Nile fever. We'll also talk about the history of the disease, how it is transmitted, the species it affects, and the clinical and necropsy signs observed. Finally, we'll cover the prevention and control measures for the West Nile virus. West Nile virus is a single-stranded RNA virus of the family Flaviviridae, genus Flavivirus. West Nile virus is a member of the Japanese encephalitis virus antigenic complex of the arthropod-borne flavivirus. West Nile virus has at least two genetic lineages. Lineage 1 is divided into three clades 1A, 1B, and 1C, and it contains both virulent and attenuated viruses. Lineage 2 viruses found mainly in Africa often cause asymptomatic infections or mild disease. West Nile virus can infect humans, birds, mosquitoes, horses, and other mammals. The birds, especially the corvids like ravens, jays, and crows, are the primary vertebrates reservoirs hosts for West Nile virus. West Nile virus is mainly transmitted by mosquitoes. In North America alone, there is evidence of infection in at least 59 species, including Culex species and Aedes species. Some female mosquitoes feed only on birds, like they are ornithophilic. However, some feed on the birds and other species, transmitting West Nile virus to the humans, horses, and other animals. The viremia that results in human, horses, and other animals is not sufficient for West Nile virus transmission, making them incidental hosts. This is the schematic diagram, and that gives a general representation of the transmission of West Nile virus. Most of the horses are infected asymptomatically. In clinical cases, the illness is characterized by anorexia, depression, and neurological signs, which may include ataxia, weakness, or paralysis of one or more limbs, teeth grinding, aimless wandering, convulsions, and circling. Tremors of face and neck muscles are very common. Some animals have cranial nerve deficits, particularly weakness or paralysis of the face and tongue, which may lead to the difficulty in swallowing. The attitudinal changes, including somnolence, apprehension, hyperesthesia, or periods of hyperexcitability, are also common. Colic and urinary dysfunction, from mild straining to stranguria, have also been reported. Some animals die spontaneously, but many severely affected animals are euthanized for humane reasons. In live horses, the clinical cases are usually diagnosed by the serology. A fourfold or greater increase in West Nile virus specific antibodies in serum, the detection of specific IgM in the cerebrospinal fluid, and the detection of the specific IgM in the serum confirmed by the specific IgG in the same or the later samples are diagnostic. RT-PCR can be used to detect the viral RNA in the equine, brain, and spinal cord samples taken at necropsy. Immunohistochemistry is used as a postmortem test. It may detect West Nile virus antigens in the equine, brain, and spinal cord. No specific treatment is available, but the animals may recover on their own if they are given the supportive care. Supportive treatment has the goal of reducing the inflammation in the cerebral central nervous system, preventing the self-inflicted injuries and adverse effects from recumbency, and providing supportive nutrition and fluids. Therapy is empiric and similar to the treatment of the other causes of the viral encephalomyelitis. Mild cases have sometimes recovered without treatment. Small animals rarely exhibit clinical illness. Case reports of dogs and cats positive with the West Nile virus report fever, depression, muscle weakness, spasms, seizures, and paralysis. Myocarditis can also be found. A serologic survey conducted in the initial epidemic area of the New York showed a low infection rate of dogs and cats. West Nile virus should be suspected in animals that exhibit neurological and cardiac symptoms. All of these methods play important roles in successful mosquito management. Surveillance, source reduction, and personal protection are techniques used by the individuals in order to monitor the mosquito populations, reduce their numbers, and limit the human exposure. Biological control, larvicides, and adulticides control methods are techniques most commonly employed on a large community wide basis. Source reduction consists of elimination of larval habitats or rendering of such habitats unsuitable for larval development. Emptied standing water in old tires, cemetery arms, buckets, and plastic covers, toys, or any other container. The water that stands in old tire piles is the ideal site for the mosquito breeding. No matter how a tire sits on the ground, it is always capable of collecting rainwater. Empty and change the water in birds' baths, fountains, wading pools, and the rain barrels and potted plant trays are at least once a week. The mosquitoes that carry West Nile virus need to lay their eggs on in a raft or standing water. By emptying the containers such as one pictured, as you are doing your part in making a habitat unsuitable for egg laying and thus the larval development. Other forms of source reduction include open marsh water management, in which the mosquito producing areas on the marsh are connected by a shallow ditches to deep water habitats to allow drainage or fish access. Well, this is the end of our today's lecture. Thank you so much.